Namaste and good morning once again. Those of who were yesterday, please pay attention. Come on. So you've seen that yesterday we had 3 different technical sessions and we had several speakers. There was a great take-home. I don't want to waste further time, but an interesting take-home was what I recall 2 things. First thing from Dr. Dhiren Shah's presentation, that bypass basically is not a curative treatment, it is a palliative treatment. Other things which are complementing it, like your diet, exercise, medicine, must go with it. It's something very important. Similarly, in Dr. Ramesh Kapadia's presentation, he mentioned about the UHP program, that it too is not an alternative to allopathic or other treatment, but it is complementing in a big way for patients with or without medical intervention. So these are some of the great take-homes yesterday. And big hand to all the doctors who are doing wonderful work. Please clap for the doctors. See, it's very easy to say, okay, the doctor is taking so much for an operation, but just imagine you could see all the what goes behind their decision making. They have to make very quick decisions to save your lives. So once again, a very big hand for all the doctors and the medical practitioners. We begin today's session with Dr. Subhash Manchanda's presentation. He is a senior consultant cardiologist with the Sri Gangaram Hospital, New Delhi. And he has got immense experience, 36 years at the All India Institute of Medical Sciences as a senior consultant cardiologist. And even after that, he's been fully active. I was just sharing with Dr. Nisan, and he's a brilliant teacher, an excellent researcher, and most of all, a humane clinician. And Dr. Manchanda's main contribution has been the original research, reversal of heart disease by meditation, diet, and exercise. And he has been conferred with the Padma Shri, the national award by the President of India in 2004, and he's been honored with several other awards, and he conducts heart reversal camps regularly by Adhyatma Sadhana Kendra at Chhatarpur, Mehrauli. And he has written over 300 original research articles and authored 4 books on cardiology. And his main contribution has been original research on reversal of heart disease. Now, I request the volunteers, Dr. Manchanda sir, please come in the front. And volunteers, please welcome in the traditional Vidyapit style with a sutar auntie. That's a cotton hand-spun cotton. Please. Sir, face the camera, sir. Rumal.
Okay.
Well, good morning, friends. This is a subject which is very close to my heart, that we can prevent heart disease by lifestyle modification. You see, you heard yesterday that these lifestyle-related diseases have become the leading cause of death throughout the world. Even in our country, at one time infectious diseases were very common, but now it is the non-communicable disease or lifestyle-related diseases. And leading them is cardiovascular disease, of course, diabetes, hypertension, stress, etc. are there. And therefore, this subject is very close to my heart. What is lifestyle and what is the importance of this? Well, lifestyle is very important. This is a slide I have borrowed from Professor Ferrari. He was the earlier president of the European Congress of Cardiology. Actually, if you see, the life expectancy of human being has increased almost 10 years, even in our country, more than 10 years. And the maximum contribution is the cardiovascular diseases. 7 out of 10 we have contributed by changing the lifestyle. Out of this 7 years, 50%, more than 50%, I think this is under stating, is by lifestyle modification, like exercise, diet, tobacco cessation. If they had added, I think, stress management, it would have been 70%, which I will show you how. And 40% is by drugs like antiplatelets, beta blockers, ACE inhibitors, ARBs, statins, and ARNIs, and so many new drugs are there, which I am absolutely confident are extremely useful. I think statins are the biggest advance that we have seen in the last decade in cardiology and contributed significantly. But we talk a lot about interventions, bypass, they have contributed only 10%. Although, as yesterday you were told, this is not the curative. It is only a palliative. The root cause of the disease has to be really controlled, and that is the unhealthy lifestyle. Oncology, cancer has contributed very little. We talk a lot about cancer, we are scared of it, only 2.4 months. So you can see that the maximum contribution to the addition of life is by lifestyle modification. Now what is this lifestyle? Very difficult to define, but it is the way we live, the way we walk, the way we take the food, etc., and the way we think. There are 4 components of this lifestyle which are responsible for heart disease. Diet, I talked a lot about it yesterday, which is responsible to these 4 main factors like dyslipidemia, hypertension, diabetes, obesity, and these are really the biggest problem of today. Of course, they are also got worsened by the other risk factors like tobacco consumption, which unfortunately is not decreasing in our country, lack of exercise, mental stress, completely ignored subject, but as I will try to tell you, mental stress may be one of the most important reasons for this, and that I will put my own data in mental stress because this has been ignored. Other things you know, but I will just pass through the other things. You see, this is the largest study done on risk factors for myocardial infarction. This is intra-heart study which was done in more than 30 countries, including India, and it showed that it is the psychosocial, it is the lifestyle factors which are responsible for this disease. For example, dyslipidemia was the first one, which I think is related to the diet. Then smoking was another factor. Psychosocial stress, for the first time, I think they found that it is, if a person is having psychosocial stress, the heart disease can increase 3-fold more. And then the vegetables and fruits which I talked yesterday, and exercise. So these, you see that most of the factors are related to the lifestyle, even diabetes and hypertension. These are the 9 factors which he said can explain 90% of the disease in most of the countries. So it is a lifestyle. I will not talk about the diet, I have talked a lot, but just to summarize, there are only things, what not to eat, only 3 things should not be eaten. One is the trans fats, the other is the sugar and refined, and the third is the salt. If you remember these 3 things, restrict your salt, don't take sugar and refined food, and avoid trans fat, means reheating of the oil and taking food from these fast food, or I call it junk stores, because most of them used trans fats in our country. And you should avoid red meat also. That is important because red meat has been shown to be harmful. And what should you use? Instead, you should use I call plant-based diet, including fruits and vegetables, and take whole grains, not and use limited amount of oil. As I said yesterday, it is the mustard oil. Use nuts also, we are extremely good, and use either a Mediterranean or an Indo-Mediterranean diet, which includes mustard oil. So I'll not go into details of that. I think I have talked a lot about it yesterday, and therefore we'll go to the other risk factors. Well, smoking, unfortunately, it is not decreasing, is the leading cause of preventable death. And not only smoking cigarettes, BDs are more harmful. This study done by my colleague Dr. Srinath Reddy, whom you heard yesterday, that BDs are possibly much more harmful because many of us think that they are not. And similarly, chewing of tobacco, the non-inhaled tobacco is very, very common, and it's increasing market in our country. This gutka, pan masala, and chewing of tobacco is extremely harmful. We have the highest incidence of throat cancer in our country. This is very unfortunate that we are chewing tobacco. And you know the health risks, I will not go into details. You all of know, you know that it can cause large number of diseases. Most important are cardiovascular diseases, the lung diseases, chronic obstructive diseases, the cancer, but there are so many other causes like cataract, it can cause life expectancy, it is reduced, asthma, and so on and so forth. In our country where environmental pollution is already there, I come from Delhi, where the pollution is very, very high. It seems that we are smoking 10 cigarettes every day because of the environmental pollution, and if we add extra smoking it will really kill us because we are adding these things. So it can cause large number of diseases. I'll not go into details, but this is the one of the most easily preventable cause which can really reduce it. And Interheart study has shown that there is a linear correlation of cigarette smoking or tobacco consumption with the heart disease. Even one cigarette is harmful. I must tell you here, you can see here, even one cigarette increases your chances of getting heart attacks. So there is a linear relationship. So even if you are taking 1 or 2 cigarettes or chewing 1 or 2 tobacco, it is harmful. Of course, more you take, the worse it is. And not only that, before the heart attack occurs, yesterday you heard, heart attack is never sudden. It takes several years before the heart attack occurs because there is a deposition of the cholesterol, atherosclerosis, and 30, 40 years it takes. So smoking increases so-called the silent coronary atherosclerosis. The hardening of the arteries starts very quickly, both by active and passive smoking. Even if people are not smoking, if they are passive smokers, they could be equally harmful. It's very common in our country, one person smoking, the houses are small, and the smoke is inhaled by the others, and therefore public places, I think it has been banned now. That's a good thing. Similarly, the risk of mortality in strokes is markedly increased. The more you smoke, the more is the risk. So very, very dangerous disease. And if you stop smoking, you will see that the immediate effects start. You start improving. Immediately your lung functions start improving and all. And by the end of 1 year, the chances of getting heart attacks reduce more than 50%. So every minute that you have given up smoking, starting from 20 minutes to 15 years, by 10 or 15 years, the risk decreases to as much as non-smokers and all. So please, those of you who are smoking or taking tobacco, they must stop it immediately, because this is the single most important cause. I call it the biggest terrorist in India, because it is killing 2 people every minute in our country. That means 1 million people are dying because of tobacco. And no terrorist kills so many people as this tobacco kills, because tobacco doesn't kill immediately. It takes several years for it to cause. But please stop smoking, and within 5 to 10 years, your risk will decrease, apart from the fact that it causes lung disease and all. And there's a lot of data also. These are the randomized studies which show that if you stop cigarette smoking, the risk of heart attacks decreases. Almost all studies have shown that it decreases by as much as 30 to 40% within a short time. Now, lack of physical exercise. More than 1/3 of the deaths from coronary artery disease in men and 38% in women are due to lack of exercise, called physical inactivity. Remember that this is the modern lifestyle we have come to. We are watching TV all the time and taking these so-called junk food, the cold drinks, which are very, very harmful, as I told you yesterday, and also not doing exercise. And this is making us very abnormal people, say metabolic syndrome with a large tummy and so on and so forth. So I think if exercise could be done, 1/3 of the deaths due to heart attacks could be reduced. And this is not difficult to do. You can do it either outside or you can do it inside on a treadmill or something. And these are the adverse effects of physical inactivity. This has been clearly shown. If you are not physically active, you get dyslipidemia, you get hypertension, the smoking adds to it, hypercoagulability. There are other risk factors, inflammation, and other things add up, diabetes, etc. is there. So I think all these things are additive. Inflammation, yesterday you heard from Dr. Nason, is very, very important, and physical inactivity has been shown to cause inflammation. If physically active people, it decreases inflammation. And of course, dyslipidemia and diabetes, you heard all that. So if you have a lack of exercise, not only you get heart disease, hypertension, you get diabetes, obesity, and also some people tend to smoke also, and this adds up. So these are all additive effects. And if you are physically inactivity, the chances of getting heart attacks are increased 100%. It doubles the risk of heart disease, diabetes, mellitus, and obesity. These are the biggest challenge to the mankind now. Increase the risk of hypertension by 30% and doubles the risk of dying from heart disease and stroke. So please start doing a physical exercise. And what is the cost of physical inactivity? Of course, it's much less than smoking, which is the costliest thing which is in the world, has to spend more than $1 trillion. In the United States, 3.2 million deaths are attributable to physical inactivity world over. Globally, around 31% of adults, and they do insufficient exercise. The economic cost of physical inactivity has been estimated to be $53.8 billion worldwide in 2013. So look at that. By not exercising, which our forefathers used to do, we are becoming poorer by $53.8 billion and also getting disability and so on. And if you do physical exercise, any type of exercise, it can be mild, moderate, or severe, it reduces weight because burns calories, reduces stress, or to a small extent, anxiety, depression, increases the good cholesterol, HDL, lowers triglycerides, the bad cholesterol, and propensity to thrombosis. Pooled data from several studies says that if you reduce, if you start walking, then the mortality will reduce in 25%, both primary and secondary prevention. So physical exercise is very important, and there are a lot of evidence that you can see that this is a huge study, Women's Health Initiative observation, if whether you do vigorous exercise or walking, and the more you do, the chances of heart disease go on decreasing. This is a primary prevention study, clearly shows that even any amount of exercise will be helpful. And effect on obesity and diabetes mellitus are also extremely good there. There's a reduction of obesity by about 25% and reduction of diabetes by 35% if you're doing exercise. On the other hand, if you do not do exercise, if you watch 2 hours of television every day, you increase the chances of getting obesity by 20% and diabetes. So sitting for 2 hours and watching the TV, which many of us do, watch the serials, can increase the chances. So don't sit that long. And each 2 hours of a day spent sitting also can increase the risk about diabetes. And so please be active all the time. Don't sit for a long period of time. And exercise-based cardiac rehabilitation. This has been clearly shown that mortality, if you are doing, this is exercise-based. Any patient who gets a heart attack or a angioplasty needs cardiac rehabilitation and reduces the mortality by up to 26%, and also cardiac mortality also by 30%. Also morbidity, return to work is, and unplanned admissions are decreased, quality of life improves, and early return to work is there. But cardiac rehabilitation is a little difficult. It's not being done in India. It's very costly. We presented a paper in the American Heart recently that yoga could replace it, yoga-based cardiac rehabilitation, and this was really appreciated. That's a very cheap method, and I will show you that could be extremely good. Another factor which is important is lack of sleep. This has come into prominence. If you don't sleep properly more than, say, 7 hours or 6 hours a day, if you sleep less, you can get heart disease. And there are so many sleep disorders like obstructive sleep apnea, which make you prone to hypertension and so on and so forth. And if you are lack of sleep, you have increased irritability, difficulty in memory. Accidents are known to be caused by obstructive sleep apnea because these people don't sleep at night, they sleep during the day while driving. And I know some of my patients who had had serious accidents because they said while driving we slept off. So if anybody has sleeping less during the day, please get it checked up, and it can also cause so many other. But this is a factor which is completely ignored, so-called the stress, the psychosocial factors. And I think there are a huge number of studies to show that they are related to heart disease. For example, there can be acute stress also, which can cause disease. For example, during 9/11, it was found that in the United States, New York, the myocardial infarction incidence increased. There was an earthquake in Los Angeles, and the data is available that it did increase in the surrounding areas, even for a year or so. So the acute stress can be harmful, and it is, for example, a spouse dies and so on, people on retirement, they are more prone to get this. So acute stress, but I think more important is the chronic stress. And these can cause depression, anxiety, anger, hostility. Each one of them is extremely harmful. For example, depression has been considered to be as bad as smoking now. After a disease, if a person gets depression, this is very, very dangerous. And I will show you the data and the social factors also, which can also cause this. Now, how does stress cause heart disease? And a lot of work has been done that when we have stress, we stimulate our hypophysis, pituitary adrenal axis. The brain is stimulated, which releases large number of these hormones, neuroendocrine abnormalities like cortisol, renin, vasopressin, glucagon, etc., which ultimately can cause hypertension, diabetes, and so on. And on the other hand, the autonomic nervous system, the sympathetic overactivity is there, which releases also bad hormones like epinephrine. And even heart rate variability is changed, And these act in a complicated manner. Ultimately, all the diseases that we know of, like diabetes, like metabolic syndrome, hypertension, heart failure, coronary artery disease, they could all be caused by this. And there is studies to show each one of these things is true. I don't have time, but I just like to concentrate that inflammation and increase oxidative stress. Inflammation is caused by stress. There are a large number of articles on this. And if you have depression, this is a Framingham Heart study. If you have severe depression or clinical depression, it is as bad as the other risk factors. You see hypertension on the top, the age, the diabetes, and on the bottom is the severe depression. And you can see this may be one of the worst factors, has been ignored for a long period of time. And if you have a heart attack or a coronary bypass surgery, you will see that the chances of getting death are almost doubled. Even in heart failure, if you have depression, in spite of all the best drugs you may be taking, your mortality is doubled. But nobody has paid attention to that because all the drugs failed. But similarly, after angioplasty, even if you do with the best stents that you have, this is a European registry of angioplasty in which more than 1,000 patients were for, and they found that people who have personality D, it's a distressed person, it's not depression. These are people who want to ignore the disease, they don't even go to the doctor. This is called personality D. So if personality D you have got even at 9 months, the chances of complications, the thrombosis, etc., are much higher, as you can see here. So even after angioplasty, if you don't take care of the personality of the person, you can have problem. The drugs have failed, and yoga has a lot of potentiality, and I will talk about that because a lot of work has been done. This is ignored in the literature. These are my things. These are not in the guidelines. Yoga, I'll just like to introduce, is not a merely few postures, but a complete way of life. It had harmonious development of body, mind, leading to physical well-being and mental harmony, culminating into positive thinking, happiness and peace. Happiness and peace have a lot to do with these diseases. It is actually a lifestyle which I tell you consists of 4 things: physical, mental, emotional, spiritual well-being. It has been shown to reduce work stress and anxiety, depression, and improve sleep. Actually, this is a holistic life, the best lifestyle ever devised. It has 4 components. The physical component of yoga is that sattvic diet, a vegetarian, high-fiber diet is always recommended. Physical exercise is a part of yoga, and no addictions like tobacco and alcohol. Mental part is more important, and meditation. There are thousands of articles which show that meditation can relieve this stress. Emotional is very, very important because all these emotional imbalances have been shown to cause disease, like anger, ego, jealousy, hostility, have all been with at least heart disease and several other diseases like diabetes. And positive emotions like compassion, love, and empathy can decrease this. There is also some experimental evidence for that. I'd like you to tell you a very old experiment which is reported in one of the journal of pathology. The rabbits develop atherosclerosis very quickly if you give them very, very high fat. A group of rabbits did not develop it, and they thought the technician has not given, but they checked with the video, they were also being fed. Only difference was the research assistant used to take out the rabbits in the lower cages, just fondle them and put them back. And this little work of little affection, compassion made the atherosclerosis disappear. Similarly, monkeys experiments are done. If they are made angry, even with a low-fat diet, they develop atherosclerosis. So I think the effect of these emotions on atherosclerosis has to be looked into. There are some old experiments available, and of course, spiritually, it also. So yoga is what? It is a holistic and intensive lifestyle. Dean Ornish calls it intensive lifestyle modification, which consists of stress management, not achieved by any other thing except yoga, healthy diet, regular exercise, and avoidance of, I call it a lifestyle polypill. I've written many articles that this is a better polypill than pharmacological polypill because no side effect, and it achieves almost everything which the, and yoga has been becoming popular all over the world, you know that. And it has been claimed to make you happy, and there are a large number of biochemical changes which occur like antioxidant, endorphins, serotonin, oxytocin, etc. appear, which can make you really happy and all, yet it can cause long-lasting happiness and prevent several diseases. Let's see in the role in the cardiovascular disease, because that's my subject. You know, cardiovascular disease or cardiac disease can be considered as a continuum. It starts with some risk factors like dyslipidemia, hypertension, diabetes, etc., smoking, which leads to oxidative stress and neurohormonal and inflammation. And yoga has been shown to act at all these. I'll go through them very quickly. Then it can cause atherosclerosis, early atherosclerosis, advanced atherosclerosis. Yoga has an effect there. It can cause myocardial infarction, and yoga has an effect there also. It can cause arrhythmias, and it can cause heart failure. All of them have been affected by the kidney. I'll show you the studies are small, but they are quite consistent. This is a lot of data. There's a lot of meta-analysis done. There is strong evidence that yoga can reduce stress and lead to improvement in both cardiovascular response and recovery from stress. Several randomized studies and meta-analysis suggest that yoga is extremely useful in controlling anxiety, depression, and psychosocial stress. Therefore, has been extensively used to control these conditions. One of the studies done from India shows it is as good as the antidepressant drugs with no side effects. The mechanism has also been studied that neurotransmitters like serotonin, GABA, and decreased sympathetic activity occur because of that. And of course, laughter is a part of yoga, and laughter is the best medicine to beat stress. If you can laugh about 40 times a day, it will be fine. A child smiles 200 times a day. Adult smiles once in 3 days, and that also. Because when you smile, the pharmacology changes. Good hormones like endorphins are produced, which are strong antioxidants, and if you are smiling all the time, even in adverse circumstances, there is a biochemical reason that you will be protected and all. What about the studies in hypertension? There are a huge number of studies, more than 1,000 studies, and at least 10 meta-analyses which have appeared in the last 10 years and all. And you can see that most of these studies, I'll not go into details of that, it has been shown to cause modest decrease in blood pressure. Modest means 5 to 6 millimeters systolic and 3 to 4 diastolic. But this is important. A small decrease in this much pressure can decrease the stroke rate by 10% and coronary artery disease by 7% or so. And it is so convincing that some years back, the American Heart Association scientific statement, they analyzed all the studies done on medication and diet, and then they came that transcendental meditation which is a part of yoga, has modest effect on decreasing blood pressure. It should be used in all patients who have pre-hypertension, anybody who has more than 120/80. We have been using it for large number of patients. We have done several studies with ambulatory blood pressure and found that it's extremely useful pre-hyper, even in resistant hypertension. Apart from drugs, if you add this, because anxiety factor may be important. In diabetes mellitus, again, there are a large number of studies. I'll not go into details. They vary from few weeks to a year. And again, there is a consistent decrease in HbA1c, as much as 1%, which is equal to most of the drugs, no side effects at all. And can it reverse atherosclerosis? This is a study we reported a few years back. You know, this was told yesterday. Indians have this problem called metabolic syndrome. They are very fat in the abdomen, a very, very common disease.